This video lecture takes a closer look at breastfeeding, including its benefits, mechanics, and potential barriers to success. Let's start by taking a look at recommendations for breastfeeding. The Academy of Nutrition and Dietetics, along with the American Academy of Pediatrics, recommends exclusive breastfeeding for the first 6 months of life and continued breastfeeding along with infant foods until 1 year of age. The World Health Organization recommends breastfeeding for at least the first 2 years of life. While almost all women are physically able to breastfeed their baby or babies, only 70% of mothers in North America begin breastfeeding at the hospital. By 4 months, only 33 of them are still breastfeeding, and by 6 months, that rate falls to 20%. It remains pretty stable up to a year, at which point 18% of women are breastfeeding their infant. These statistics are for Caucasian women. Minority women are even less likely to breastfeed. Given the recommendations for breastfeeding and its many health benefits for both mom and baby, why are these numbers so low? While breastfeeding is a natural way to feed babies, proper technique may not come naturally to new moms. They may never have seen other women nurse or been taught to nurse by their mothers, grandmothers, or sisters, and therefore lack good role models. Since there's a bit of a learning curve to nursing, family support is essential, especially from the father. Reassurance from healthcare providers that the baby is getting adequate nutrition will help the mother relax about breastfeeding and be more successful. Newborns who are breastfed should be monitored by a doctor or lactation consultant during the first week after discharge to ensure the baby is getting adequate nutrition. Above all, breastfeeding requires patience, which may be hard to come by when sleep deprived. With adequate support, correct information, and time, soon the mother and baby will establish a technique and routine that leads to an enjoyable feeding experience. There are 2 parts to breastfeeding: production of milk and getting that milk to the baby. During pregnancy, hormones from the placenta signal the breasts to form lobules, or milk-producing cells. After birth, infant suckling stimulates the release of the hormone prolactin, which in turn stimulates the synthesis of milk. Continued suckling by the baby is required for milk production. The second phase is for the milk stored in the breast to get to the suckling baby. This process is called the letdown reflex. The hormone oxytocin, released by the brain, allows the breast tissue to release the milk from storage sites. A tingling sensation in the breast lets the mom know that the milk will soon begin to flow. The reflex is inhibited by tension, lack of confidence, and fatigue on the mom's end. It is therefore important for new moms to be confident that they are providing adequate nourishment to their baby. This can reduce tension and increase confidence. Since it is difficult to know how much a baby is taking in, some signs of successful feeding include 3 to 5 wet diapers per day, normal weight gain in the baby, and at least 1 to 2 stools per day. Other signs that point to successful nursing is a softening of the breast tissue after feeding. This indicates that the previously full and harder breast has been emptied of its milk. It's also important to keep in mind that it may take a while for breastfeeding to be comfortable for both mom and baby. Ideally, bottle feeding from expressed milk should occur only once breastfeeding has been established. The mechanism for suckling is different from the breast and bottle, so waiting that one has been established before introducing the other is a good idea. Anytime there is hesitation about the adequacy of feeding, it's important to consult a physician or lactation consultant. The composition of milk is tailored to the baby's age and also differs during feedings. The first milk produced by mothers is called colostrum. It is a thicker Yellowish fluid rich in antibodies to help build the baby's immune system. It also contains Lactobacillus bifidus factor, which stimulates the growth of Lactobacillus bifidus bacteria, which limits the growth of toxic bacteria in the baby's intestines. Colostrum can also help facilitate the passage of meconium, the baby's first stool. Eventually, the composition of milk changes into mature milk, a thin, watery substance that can have a bluish tint. It contains easily digested proteins, some of which bind to iron, reducing the growth of diarrhea-causing bacteria. Other proteins enhance the immune system. Lipids in breast milk are high in linoleic acid and cholesterol, both of which are important to brain development. In addition, the long-chain omega-3 fatty acid DHA contained in milk helps the synthesis of tissues in the brain and nervous system and the retina of the eye. Proteins in human milk are synthesized by the breast tissue and can also enter from the mother's bloodstream. These proteins include antibodies and other immune factors. Fats come from the mother's diet and from breast tissue, while the sugar galactose is synthesized from the breast and glucose comes from the mother's bloodstream. Galactose and glucose from lactose, the main carbohydrate in human milk. During each feeding, the composition of the milk changes from the beginning to the end. Fore milk is the initial milk released, and is similar to skim milk in that it contains less fat than the hind milk that comes after 10 to 20 minutes of nursing, and that milk is more like cream. It's important for babies to nurse long enough to get the rich hind milk that will sustain them until the next feeding. The composition of human milk allows for adequate hydration of the baby without the need to provide additional fluids. Too much water would eventually lead to low blood sodium, brain disorders, and other problems. Supplemental water or juice should only be provided to the infant under physician's guidance. Women who breastfeed their baby have similar nutritional needs as pregnant women. While folate and iron needs are decreased, the need for calories, vitamins A, E, and C, riboflavin, copper, chromium, iodide, manganese, selenium, and zinc are increased. To meet these requirements, a nursing mom should include 3 cups of calcium-rich foods or drinks, 6.5 ounces of protein, 3.5 cups of vegetables, 2 cups of fruit, 9 ounces from the grain group, and 8 teaspoons of vegetable oil. Fish should be consumed twice a week to provide adequate omega-3 fatty acids. This only leaves about 360 calories for foods containing solid fats and added sugars. It is important to keep in mind that just like during pregnancy, what the mother consumes can be passed to the baby. While milk production requires approximately 800 calories per day, only 400 to 500 extra calories per day are recommended in order to allow for gradual weight loss of 1 to 4 pounds per month until the mother is back to her pre-pregnancy weight. Fluid intake of 13 cups per day is recommended for the mother to stay hydrated and to ensure adequate fluid for milk production. Human milk alone meets infants' needs for the first 4 to 6 months of life, after which solid foods may be gradually introduced. The AAP recommends that all infants be given 400 international units of vitamin D per day, and supplemental iron can be recommended for special situations. Fluoride supplements are not advised for the first 6 months of life, and vitamin B12 supplementation is needed for infants whose mother is vegan. There are many advantages to breastfeeding. Due to the antibodies present in human milk, there is a decreased risk of infections for infants. Breastfed infants have fewer ear infections, likely because they don't receive bottles while going to sleep, which leads to pooling of milk in the mouth, creating a prime environment for bacterial growth. Breastfeeding infants have reduced risk for many diseases, in addition to lowered risk of obesity and type 2 diabetes, lower rates of type 1 diabetes, celiac disease, and inflammatory bowel disease, as well as childhood leukemia and lymphoma have been observed. Breastfeeding also reduces the chances for food allergies, and it is a convenient and cost-effective way to feed babies. This table provides a good list of benefits for babies and also include potential benefits for mothers. In breastfeeding moms, the uterus returns to its pre-pregnancy state quicker. There is a decreased risk for some chronic conditions, as well as decreased risk of ovarian and premenopausal breast cancer. A breastfeeding mom can potentially return to her pre-pregnancy weight faster, and there may be a delay in return of ovulation, which reduces the chance of another pregnancy in the short term, allowing a mom to recover before another pregnancy. You may pause this video if you'd like to take a closer look at all of these benefits. There can also be barriers to breastfeeding for many women. The main barrier is misinformation. Some women might think that their breasts are too small to produce adequate milk to feed their babies, when in fact, breast size is irrelevant to successful nursing. As mentioned earlier, others lack good role models to help them through some challenges. Thankfully, many hospitals now have lactation specialists available to provide support and instruction to new moms learning to breastfeed. Most communities also have a group called La Leche Leagues. It is a wonderful source of sound information on breastfeeding and also provides classes and advice for women who are struggling with an aspect of breastfeeding. Many hospitals and doctors' offices provide kits to new moms that include free formula for babies. While this may seem like a nice practice, it can actually undermine a woman's confidence in breastfeeding and provide an easy alternative to breastfeeding when challenges come up in the beginning stages of nursing. For breastfeeding to be successful, it requires regular infant suckling. Alternating breastfeeding with formula bottle feeding in the early stages can reduce milk supply and make it more challenging for baby to become efficient at nursing at the breast when a bottle is offered as well. Returning to work can make it challenging for new moms to continue breastfeeding. One solution is to use breast pumps to express milk at the workplace. This milk can be fed to the baby in a bottle. Federal legislation requires employers to provide reasonable breaks for pumping milk and a private place to do it other than a bathroom. To save the milk after pumping, it needs to be refrigerated. It can be kept that way for up to 4 days or frozen for up to 6 months. Once thawed, it should be used within 24 hours. Expressing milk with a pump also requires mothers to be on a regular pumping schedule to ensure continued milk production. Other barriers may include social concern and embarrassment about nursing in public. Breastfeeding in public can be done discreetly, and there are many contraptions available to help ensure privacy. Infants or mothers may be unable to successfully breastfeed due to certain medical conditions, including galactosemia, the inability for the infant to digest galactose. If mothers need to be on medications that are dangerous for the baby, bottle feeding is advised. While nipple piercings do not impact the ability to breastfeed, jewelry should be removed prior to nursing. Finally, if a woman does not want to breastfeed her infant, it is important to respect her decision and not to pressure her or make her feel guilty about her choice. Breastfeeding is a personal decision and commitment that no one should be forced into.